BizTech's Health and Wellness Show. Today we speak to Pervaiz Gul. He's the Group Chief Executive Officer of CaringUp. CaringUp is the creator of a unique platform designed by world-leading care specialists and behavioral scientists to help patients with chronic conditions and their families live a better life. Now, Pervaiz, welcome to the show.
Thank you so much, Brian. It's a pleasure to be here.
Now, Pervaiz, give us an overview of your company and its history.
Okay. CaringUp is a very young company. It's founded by leading healthcare experts from US and in Southeast Asia. It primarily looks at chronic disease management, but it is very specific around compliance management. Compliance is a major issue, but before I get into that, the fact is that 1 in 3 people in the world have chronic diseases, multiple chronic diseases. This is a health crisis. It is advocated by World Health Organization as well. And this is getting more serious. We can't prevent them. There's a lot of investment in prevention of chronic diseases, but it is also a factor of age. We are an aging society. We will get more people with chronic diseases. So what do we do about people who already have chronic diseases? We have to manage, we have to support, and we have to educate that population. One of the factors that is aiding this crisis is non-compliance. And nobody is actually looking at it as seriously in Southeast Asia, Asia Pacific, and in broader Asia Pacific markets, Asian markets, and developing countries. So we saw the gap. Our founders, healthcare experts saw the gap. The oncologists, the cardiovascular diseases experts, we spoke with them. We spoke with behavioral scientists. We studied the problem in a lot of detail. And that's where CaringUp came from. How do we help that?
Now, I want to zoom in a little bit on what you just said in terms of medical compliance. Why is that so important? And explain the rationale behind it.
Okay. More than 1 billion people in Asia, Asia Pacific have chronic diseases. Around the world, we have multiple billion people. Less than 50% comply with their prescription alone. And prescription means the medication that has been given to them. These are chronic diseases. The medication would be for 1 year, 2 years, it's long-term, or for the rest of their life. To manage their condition, to avoid it getting worse, they have to follow the prescription. But data after data, research after research in every country, in developed markets, developing markets, shows that compliance is less than 50%. Now, it creates very serious problems financially and non-financially. When you look at financially, actually it increases, the non-compliance increases the hospitalization rate or rehospitalization rates by 200%. The payouts, the cost of healthcare increases by 300%. In US alone, 125,000 people die every year because of non-compliance to prescription.
Now, what are the reasons for this in terms of non-compliance? Is this just pure laziness, or this is a stubbornness of older people, for example? And I'm speaking from experience, so you can hear that in my voice.
Well, I have my parents and I have my family members as well. So do our founders, who are doctors, physicians, quite well known, and they have the patients as well. It's a complex problem. Non-compliance is a complex problem. It has been there for ages. Like I mentioned, WHO also says if we actually fix the compliance issue, if we were to improve the compliance, it will have a far greater impact on the health of the society than any invention in the treatment side of things. So is that serious? There have been solutions in the developed countries. Developing countries are lagging behind. There is no focus on that. The reason is, again, like I mentioned, it is a complex problem. There is intentional non-compliance and unintentional non-compliance. Unintentional means that there is forgetfulness, which is natural because people with multiple chronic condition would have at least 6 medicines. Some have 13, 20 medicine to take at a time. And each of that medicine, some will be injection, vaccines, and pills, and capsules, and liquid, and so on. Some you have to take twice a day, some 3 times a day, 3 pills of this, 4 pills of that, etc., etc. It's very hard to remember. It's very complex to organize all these things. So people with seniors, especially, they forget, but even people in their 40s and 30s who have chronic diseases, they tend to miss out. This is unintentional non-compliance. They forget, they misplace. So that's one part of thing. 40% of the non-compliance is because of unintentional. Then there is intentional non-compliance, and that is because of lack of education and behavioral economics, behavioral science comes into the picture. There is fear of side effects. Some medicine do have side effects. So the patients who are taking it on the long term, they take it for maybe 1 month, 2 months, and after that say, it's just too painful. I don't want to take it. There are misunderstandings. For example, in Malaysia, there will be halal and non-halal conversations. They will talk about ingredients and so on. So it's a complex dynamics of intentional, unintentional. Just the reminders that we do is not going to help. We have to take a holistic approach that CaringUp is taking.
Okay, tell us about your approach to improving the situation.
We take, there is medical side of the approach. There is behavioral science side of the approach. In our team, we have both. We are very strong at that. The platforms is not designed by the techies. The platform is designed by medical experts and people who are experts in behavioral sciences. We see it, we see this problem as a behavioral issue. And we target developing countries. The dynamics in the developed countries where we see these solutions is very different than in developing countries. For example, the social infrastructure, the healthcare infrastructure in US, in Canada, Europe, Australia, these developed economies is very different. A patient is well taken care of by the infrastructure that is provided to them. There is individualism in care as well. The families are not burdened by the healthcare and the caregiving of the senior or the patient. Everything is there, so the solutions are catered for that. But in our economies, in our environment, it's the family that is the driving force. It's the family that is the primary caregiver. And we take that into account. Actually, that is a building block. The center of our universe is not just patient. The center of universe is the family and the patient. So we take care of the patient. Our platform drives that behavioral change. But at the same time, we incentivize, we empower the families to take care of their loved ones as well.
How do you do that?
There is reward mechanisms.
Okay.
There is guardians and there is dependence relationship.
So when you say reward mechanisms, is that a gamification of basically care?
Yes, we actually, in fact, we will pay the children and the family members to take care of their loved ones who have chronic diseases. That's the short and sweet way of putting it. Okay,
interesting. And obviously then, so the value proposition you're creating is really better care for the patients. Overall, obviously, it helps their families in terms of the caregivers and the extended, but also I think that's the other side of the equation that people don't really see. It's the reduction in the cost, better care on one side, but the reduction in the cost of healthcare on the other side. So not only the impact financially on the families, but perhaps on payers, healthcare payers, so your insurers, the overall healthcare system as well.
Absolutely. So that's another differentiator in our approach. On one side, our center of universe is obviously the patient and the families, but it's not done in isolation. We create an ecosystem of support, the support from the family and then support from the hospital systems, from the payers, from the governments as well. We involve them in the care. We develop programs with them. There is data insights. There is care continuum that we enable. Technically speaking, the hospitals now have more opportunity. They have more tools with us to take care of high-risk patients. with the consent of the patient and the family.
So does this involve your CareAid mobile app as one of the pieces of the puzzle?
That is one of the pieces of the puzzle. There are other tools available.
Can you tell us about it and share how that all works together in an ecosystem?
So CareAid is a smart application. It has machine learning and AI, reward mechanism, behavioral change. That is for the families and the patients. Families can take care of the patients even if they are not staying together. So there's remote management of compliance, and compliance in a broader sense, compliance not just to the medication, but also to the health vital stats. The blood pressure needs to stay within some range. The cholesterol needs to stay within the range. So that's the consumer side, the patient and the family side. Then we have tools for the hospitals that enable them to provide a care loop. And the care loop means that the current situation is the doctor sees the patient and then gives them a date to see them again in 3 to 6 months time, sometimes 9 months. The hospital, the caregiver, the hospital system, the physician doesn't know what happens in that 6 to 9 months time. And if we see the non-compliance rate is very high, often when the patient goes back, the situation is worse than what it was 3 to 6 months ago. So we empower the hospital systems with the consent from the patient to intervene when they see that the compliance or the health stats are going downwards, and the hospitals can actually call the patient and say, we are concerned that your data, your compliance, your numbers do not look good. So we would like to see you early to understand what the situation is and make things better for you. So
and that's something that's a game changer, because that's going to improve outcomes tremendously because you have early intervention.
Exactly. And that actually leads to the financial impact as well. Even though in Malaysia, the government puts in a lot of investment in the healthcare, a lot of people still pay out of pocket. And the out-of-pocket expenses in the healthcare are increasing. The non-compliance hits the consumers, it hits the families, it hits the patient. At the very least, they have to get hospitalized, and that is an additional burden, emotional burden and financial burden. The government and the payers get hit quite significantly with this non-compliance issue. So early intervention helps the payers make significant improvements in the cost efficiency. So that's how.
So you've got a partnership with the National Heart Institute of Malaysia, IJN. Tell us about that and what outcomes you hope to achieve together.
So firstly, we are a social enterprise, right? So as a social enterprise, CSR is top of our agenda. Our partnership with IJN comes into that play. We have other partnerships that are soon to be announced. The context of this partnership is to facilitate the hospital to provide better care, to intervene where it is needed, and at the same time, empower the families and the patients who come to National Heart Institute, IJN, to take better care of themselves, to help them, support them, and incentivize them to comply better with their prescription. It helps the patients, it helps the hospital, it helps the larger community, and we see.
Now, could you give us an idea of what are the costs associated for using your services? Who pays? Does the payer pay, the healthcare provider, or the patient? How does that work? What's your business model?
So CareAid comes in 2 versions. There isn't much of a difference between the 2 versions actually. One is a free version. Anybody can download it and take care of the dependents. And there is a premium version which actually has a lot of machine learning and insights and triggers, and it tells you, advises you, and makes recommendations to you. So that is a premium feature which is quite cheap as well. It is for the whole family, but I'm going to focus on the free version. It gets everything done that we have been talking about so far. We have quite a large community that is already using it. About 30,000 people are already using it within this small region that we have, and it is increasing rapidly on day-to-day basis. It's all free. It's our CSR that we work with the hospitals and we empower them. There's no cost to the hospitals as well.
That's fascinating, and I really see the value of what you are doing. So how do we start using the platform? If we want to do that, we just go to go to the internet and download it from the Apple Store or whichever platform you're using.
Exactly. Just go download it, take care of yourself, take care of your family, and every time you comply to your medication or your family's medication, get rewarded, get gift cards, get discount coupons from our partners. No strings attached.
Interesting. You know, it's been a fascinating conversation, Pervaiz. But before we leave, any final thoughts you'd like to leave us with?
Sure. So I would emphasize that the compliance, the chronic disease is actually a serious problem. It is making things worse. COVID was our crisis for the last 2 years. It has pushed the chronic diseases and the compliance issue a bit down, but it is coming back up again. I would urge everybody who has chronic diseases to comply to their prescription. We are providing the tool. It is free of cost. We are incentivizing you. So it is our wish from our heart. We are a social enterprise. We would like to see as many people using it. Go ahead and use it. Get incentives, get rewards. It's all free.
Now, Pervaiz, thank you very much for taking your time to be on the show.
My pleasure. Thank you so much for having me here.
I'm Brian Fernandez, and we've been speaking to Pervaiz Gul, the Group Chief Executive Officer of CaringUp, on BizTech's Health and Wellness Show. This video and podcast will be on our various social media platforms, as well as our website, www.biztech.asia. Please like and subscribe to our various platforms. Thanks for tuning in.